ahead again.
Yes, we're fine. We're back on again. Thank you.
Thank you. So as I was saying about the 3-year-old survey, the survey was halted or suspended early, and the report was published last week, but sadly too early for me to submit any results with this paper. But just to give you some headline figures, I think the sad thing is that in the 10 years since we did the last 3-year-old survey, we've made little impact on the prevalence of dental decay in 3-year-olds. So that is another, it just adds to the weight of some of the evidence you've already heard from Joe and Rachel. In terms of the future of the programme, we're still hoping to run the now delayed 5-year-old programme that should have run across the current academic year, with the hope that providing we can run a national calibration exercise in the summer, that we will be able to start data collection at the beginning of the next academic years. But that is all dependent upon COVID. Next slide, please. So now let's look at some data for Wakefield itself, and looking at the last 5-year-old survey. What we see here is the results of the last 5-year-old surveys. Now, you remember I mentioned that we do these surveys by positive consent, and although, as I mentioned, we have a wealth of data before this, very difficult now for us to make comparisons between this data and earlier data, because that was collected by what we term negative consent. And what we have to remember when we're looking at any of this epidemiological data is, because it's collected by positive consent, and that means a parent or guardian has to sign the form to enable the child to be examined, we do know that this underestimates the prevalence of decay in the population, because we know that for a variety of reasons, the children with the highest needs are often the ones who don't participate in the survey. Whether that's because the parents know that the child has a dental need and doesn't want that highlighting, or the child lives within a chaotic environment where the forms just never return to school. But what you can see there is that, the prevalence appears to be decreasing in Wakefield, but it's still worrying that we have 1 in 4 children with experience of, at 5-year-old, with experience of dental decay. And although this is better than the mean for Yorkshire and Humber, it's still worse than the national average. Next slide, please. So we know that 1 in 4 children in Wakefield 5-year-olds have decay. And of those children, they have on average 3.5 teeth that are affected by that decay. Now, a 5-year-old child would normally have 20 baby teeth. So that's, it's almost a fifth of their dentition has decay. 3.5% of these children have had at least 1 tooth extracted. So, you've heard Joe and Rachel both talk about general anaesthetics, and children of this age will invariably, to have had those teeth extracted, that will have been done under a general anaesthetic, all feeding into that horrifying statistic that it's the commonest reason for admission of children to hospital for surgery. Almost a quarter of the decay is active, or almost a quarter of children have active decay, and almost 1 in 10 children have decayed incisor teeth. And this again lends weight to the reason why we need the oral health promotion programs and adopting that life course approach and getting oral health messages to parents as early as possible with children, so that we prevent this decay, because we do know that the children who have decay in their baby teeth are more likely to be the ones who then go on to have decay in their adult teeth. Next slide, please. Decay is not equally divided amongst the population, and we have a lot of very strong evidence, and you can see it here, that the majority of decay is concentrated in the poorest in our society. So experience of dental decay is strongly correlated with deprivation. Next slide, please. And similarly, some groups in our society experience more dental decay than others. And we can see here that across Yorkshire and Humber, those who identify themselves as from either an other ethnic background or the Asian British backgrounds have substantially greater amounts of dental decay. Next slide, please. And I talked about, so we've talked about distribution by virtue of deprivation, by virtue of ethnic group, but it's also distributed, and this is related to both of those indicators, also where you live. Now, the survey as it's currently commissioned for Wakefield commissions the minimum sample. That allows us to look at the data to we can't look at the data generally down to ward level, because you would need to commission a much bigger sample. But we can use the data and look at it in geographies that local people might understand. So I'm hoping that the members on the call here will recognise these geographies. And it gives you an idea of just how the experience of decay amongst 5-year-olds is distributed amongst the population of Wakefield, and that those children living in the Wakefield Central and North West school cluster area, 1 in 2 children have experience of dental decay at 5-year-old, whereas in the South West cluster it's only 1 in 10. But even that 1 in 10 for a preventable disease is too much. Next slide, please. So moving on to water fluoridation. Now, Joe's already stolen some of my thunder here. In this, and the first couple of slides here is I hope you've heard before, but as a bit of revision, fluoride itself is a natural element. It's present in all water supplies, and we have very, very strong evidence that the optimal concentration of 1 part per million of water can reduce the likelihood of developing tooth decay, but also minimise its severity. And what a water fluoridation scheme does is it takes the natural level of fluoride and tops it up to that optimal 1%. And we've got lots and lots of evidence from both the UK and worldwide that it's a safe and effective public health measure. And certainly in the UK, we have schemes that are over 50 years old. Next slide, please. Water fluoridation, you don't consider it in isolation. It's one of a range of interventions that you would put in place in the population. But the along with access to fluoride toothpaste, access to fluoride varnish, but the advantage it has over those other two.
The dentist, yeah, CCG, if you can, which is one about residential homes.
Sorry, could someone go on mute, please? Thank you. It doesn't require individual behaviour change, and it doesn't require that going to the shops to buy the toothpaste. It doesn't require somebody making an appointment with a dentist and to access the fluoride varnish. And we know that as I've already mentioned, it reduces the experience and severity of toothache, but it will also have an impact on hospital admissions for tooth decay. And it's the one oral health intervention that we have that will reduce inequalities, because deprived areas see the greatest reductions in decay experience and severity. Next slide, please. Now, in terms of the white paper, tucked away in there, the Secretary of State is making a proposal to shift the decision-making responsibilities for water fluoridation from the local authorities back to the Secretary of State. And this would remove the barrier that many local authorities perceive for instituting water fluoridation, and which is often a financial barrier, because it's expensive to undertake the public consultation required, and then funding needs to be found for the revenue costs to support the scheme. It also opens up possibilities around, because at the moment, because it's a local authority responsibility to consult and work with their neighbours, it does require frequently multiple local authorities working together to propose one of these schemes, because of the water distribution networks, because our water distribution networks now have much more interconnectivity between local authority areas and are no longer necessarily confined by a local authority boundary. I think the message from my perspective is this is a potentially welcome move. We know that the Secretary of State is supportive of water fluoridation, but at the end of the day, they are proposals. They are yet to undergo consultation, and any changes are going to require primary legislation. So our message, the current message to local authorities is it's essentially, where it comes to water fluoridation, it is currently business as usual. That brings me to the end of my presentation, and again, like Joe and Rachel, I'm happy to take questions at the appropriate point in the meeting. And thank you.
Okay, thank you very much. Thank you for the presentation, all three of you. Now, I have got a first question from Councillor Kevin Swift, which is regarding the school clusters that you've mentioned.
Yes, it's the display that's got that heading, Wakefield School Clusters, and there's quite a dramatic difference between the cluster that's referred to as Wakefield Central and North West, and pretty much all the rest of them. When you look at the figures a bit lower down, most of the numbers are not quite so dramatically different. So a double-headed question. Firstly, was to clarify what areas are actually covered by Central and North West, because it's nothing like as self-explanatory as some of the others where they refer to Normanton, Featherstone and things. Are we talking about Wakefield City plus basically the kind of Stanley, Outwood, Renthorpe areas, or does it also include the Ossets and the Horburys? That's question
Thanks, Kevin.
one.
That was precisely my question as well. It's a broad brush here in terms of that
I've got to follow up on the actual
number.
Substantive, but that's the first bit.
Okay, we'll have an answer to that one, please.
I'm gonna pass that back to my public health colleagues, because they were the clusterings that they requested from PHE when we did the locality reports.
Yeah, Chair, it's Julie Owen, again from Public Health. Thank you. That cluster doesn't. Yes, it will apply to Wakefield Central. I don't think it includes Osset and Horbury. I would have to go back to what happens with we approached schools to participate in the survey, so I would have to go back to review that, but I think you are looking at Wakefield City for the schools that were in Wakefield City, but not Horbury and Osset.
Thank you for that. Can I just suggest that you do go back and find out, which will be very helpful to us all, it's alarming, find out which wards under the public health, because the schools will be identified within wards, and Wakefield City has got 3 wards surrounding it.
Yes.
So the schools appropriate to that will give us an idea in terms of the issues about where it covers. So can we have that information sent back to Andy, please, when you find it?
Absolutely.
Okay. That's wonderful. Thank you.
Yeah. My question about the substantive content.
Yes, go ahead, Kevin.
Have to proceed on the basis of a bit of speculative assumption. Pending the clarification, I'm going to assume that Central is the same thing as Wakefield City, probably minus, I'm assuming Wakefield South Ward is in with what they call South West. Now, so Kettlethorpe and Beckett's are probably in South West. But I'm assuming that the reference to North West has got to mean something. So at the very least, we're talking about an area which is Wakefield City plus out, I mean, the school areas, Wakefield City plus Outwood Grange. Now, although there's a lot of deprivation in that area, when you take the totality of it, even without Ossett and Horbury, it's not so dramatically deprived that you'd expect a figure that's roughly double the highest of any other, because there's a lot of deprivation in some of those others as well. Part of my question is it the experience of the dental professionals that the condition of teeth in kids in Wakefield City is actually so dramatically worse than in, you know, Normanton and Featherstone? Or is there actually a bit of a quirk in the stats? I think the latter's possible, because, as I say, when you look at the actual figures below the headline figure, there's only really one of them. That's the one on the top line that says 1.9. And while the Wakefield City and Northwest, whatever it might be, does come out fairly bad on any of them, that 1.9 figure is the only one that's kind of anything remotely like the same dramatic contrast that the overall figure of 51.4, when the next highest is 26. Anyway, so alongside the clarification about the areas, I think really some further comment, drilling down a bit behind that superficially absolutely dramatic contrast between Wakefield City and all the rest. Thanks, Chair.
Thank you, Kevin. Obviously, we've asked the question and we'll get more detailed answers, which will enable us to have more information about how that figure was compiled and compiled. Next, I've got Councillor Mrs. Olivia Rowley, who's got a comment and a question. Olivia?
Thank you, Betty. Can I just say, first of all, that I actually remember the presentation on fluoridation some years ago, and generally, certainly my constituents voiced that they didn't want it. So I'm quite concerned that on the one hand, the professionals are in favour of it, and it's going to be more centralised so that we once again don't have that democratic control. So I have mixed feelings about it. Can I just say about experiences? First of all, when my children were small, I took them to the dentist with me, and so they gradually got into the habit of going. And at some stage, and they in turn do that with their own children, but at some stage, I was transferred without any consent from a National Health Service patient to a private patient. And therefore, when I go, I never really know how much I'm going to have to pay. And I would have thought for people that are on limited incomes, that is kind of a real barrier. It's not entirely clear how you become a private patient and the exact costs that are going to accrue, but it's a very costly business going to the dentist, and I think it's very off-putting. I'm not sure that as a mother with very young children, being provided with a toothbrush and toothpaste for a month-old baby is actually going to make that much difference, but I would like to see the evidence. And then finally, can I say that my mother died earlier this year, aged 95, and she went into a home 16 years ago, and in all that time, however much I tried, I could never ever get a dentist to come and see her. And because she was in a wheelchair, they often said that it wasn't possible to get her to the dentist that she'd gone to for many years before she was went into a residential home. And frequently, if she was lucky enough to be helped to wash her teeth at night, she was often put to bed and then given a drink and biscuits. And so to some extent it negated the fact that she'd washed her teeth. So I just worry that kind of we haven't got it right at all in terms of young families or the elderly. Finally, there used to be, can I just ask for an explanation? There used to be a clinic next to Wakefield College in which they dealt with emergency cases. Is that no longer the case, or is it out of the area? Thank you.
I can respond about the clinic next to the college. There is still a clinic there, which is our central clinic called Newstead House, and the emergency dental service use Newstead House on a Saturday and a Sunday to provide emergency care. I'll let Joe respond perhaps about some of your other questions. Thank you.
Yeah, thank you. I was trying to unmute myself. Sorry, it's one of these new issues that we have under the COVID problems. So getting back to your first point, as an NHS patient, you said you were converted to being private without your consent. Really, that is something that should have happened. You should have been informed that you were no longer to be seen under the NHS. Now, having said that, under NHS regulations, certain people do have to pay charges. Some of those charges can be deemed to be expensive, but they're set by the government. And they go up 5% year on year, which is considerably more than the uplift than anybody in the NHS gets on a yearly increase. So the patient is paying more, and the government is paying less for NHS dentistry and practices. But certainly you should have been informed that you were going to become a private patient, and you should have been it should have been made clear for you. So you would either stay with that dentist, or you would move to another dentist for whom you could see NHS under the NHS treatment. With regards to not thinking that it's important that a toothbrush and toothpaste being given to a mother of a 1-year-old, I think it's imperative that that message gets over. There is a push to try and get all children under the age of 1 to be examined. It's not just the examination of the child that's carried out, it's also having some sort of education of the mother about how to address the diet and when to start brushing the teeth. And if they're given a toothbrush and toothpaste, then that can start straight after that that contact is made. But certainly from a dietary point of view, at the age of 6 months, when the first tooth comes through, the new mothers should be informed that milk and water are the best things to give children to drink, not juice, not juice without sugar, no added sugar, diet, the whole thing. Anything like that is deemed to be erosive and certainly can give rise to dental decay. So that message really should be given and reinforced, because obviously we've got the health visitors on the 0 to 19 team coming in. If we can get a contact with a dentist or a dental care professional within the practice to give that message, that these messages are being reinforced as being important. And also the number of times that children need to be overseen to brush their teeth in the early years, that hopefully that will become instilled as a habit, and they will be able to do it unsupervised later on. But these messages have to get through from the very start. With regards to your point on the elderly and care homes, this is a major problem and has been since 2006, when the current NHS dental contract was established. Prior to that, dental practices were able to visit care homes, make dentures, provide some sort of examination for patients who are sometimes the very simple extractions can be carried out then. That's not possible now, because that has not been contracted for in Wakefield, and it is something, as chair of the Wakefield Local Dental Committee, I've been calling on since 2006 that this be addressed. But unfortunately, the commissioners then, it was the Primary Care Trust and subsequently NHS England, they have limited funding for dentistry, and they have not been prepared to provide care for or provide the facility for dental practices to visit care homes. That has been one of the responsibilities, one of the many responsibilities passed on to community dental services, and they're hard pushed doing what they're doing to be given this additional burden of treatment and care to provide. Hopefully, when I refer to in my talk about the flexible commissioning and the transitional commissioning that NHS England are working with LDCs to provide, that this may be something that we can look at, so that the activity that is not covered by these units of dental activity, this 10% activity that can be provided outside of practice, is something maybe that could be look to address some of the needs in care homes. So hopefully that goes some way to answer your question, Councillor Rowley.
Thank you, Joe. I know Kevin has put a question in the box about who to contact from the council's point of view. I can tell you I've had experience of that of late, and it's absolutely horrendous. Anyway, I'm just having a little bit of trouble, so I'm steering around it here myself at the moment. I'm looking in the message box and I can't see any other question that's come up yet. What I would like to just move on a bit in terms of what's...
Chair, I have a question in the box.
I can't see it, Martin. I'm having problems. Okay, Martin, go ahead.
Yeah, thanks, Chair. Yeah, I agree what Kevin and Olivia said, that looking at the statistics, and obviously it's to do with deprivation, but because when people move to a new area within Wakefield and where else, they can register with a GP, but obviously they have difficulty registering with a dentist, and that's the problem. Unless people have the money to pay privately, they can't take themselves or maybe their children to the dentist, and that's one of the problems. So is there, for the people that are presenting this document and the experts, is there any movement on extra funding, or things are going to change so people with families, etc., can register as an NHS patient? Because obviously a lot of people don't have the funding or the money to pay for private dental care.
Yeah, that's a very good point, Councillor Johnson. Again, this is something that has come out of the 2006 dental contract, where the funding for dental care has been ring-fenced and limited. There's a ceiling being put on it, and each practice is given a fixed sum to achieve a certain amount of activity. And once they've achieved that activity, even if they had the ability, the time, the space, the workforce to provide additional activity on top of that, they're unable to do so because there's an inability of NHS England to shift money around, and there's not been any oral health needs assessment with regards to this contract and how it's being provided for since 2006, and the contract values that practices have been set since 2005. It's really something that we have been crying out for as a profession, that the money should be able to follow the patient, and that the practices should be able to, if they can, accept new patients, children, adults, the whole gamut, because the NHS is there for all. But unfortunately, the funding that is provided by the government in England covers about 52 to 54% of the population. So if you're in that other section, then you're going to find it very difficult to get an NHS dentist. Now, going back to this flexible commissioning point that I'd raised, this is something that is starting to develop, is practices who sign up to this flexible commissioning addition to their contract, will have to be able to show that they're taking on new patients. And so it's only practices that are going to be able to have the capacity to do that will be able to sign up for this. It's a fixed number of practices, not every practice that's able to avail of this flexible commissioning. And again, this is something I spoke to with the commissioners last week, saying with the remobilisation of dental services and going back into trying to achieve some degree of normality, will the numbers of flexible commissioning practices increase? And they were not able to give me an answer because they said they did not know what their funding was. And this is a week before the end of March. And so I would say that things may well improve to a small degree, but it's not going to be anything significant. And I'm really aware, my practice, as Councillor Road says, on Dewsbury Road, I'm aware of the hundreds of new houses that have been built at the top of Dewsbury Road. Where are they? Are we supposed to take them on as patients? What about the thousands of houses that are being built and planned for over in the East Moor Outwood area? There's not any, there are no plans to further expand dental practices in Wakefield, to my knowledge. So, sorry I'm the bearer of bad news, but we are trying to do what we can. But it really is something that maybe local authorities can say, look, we need this, we need access to dentistry addressing, and to try and put some sort of pressure on the Department of Health and the NHS England to do so.
Thank you, Joe. I just want to come in here, if I may, from the presentations that we've heard from everybody. Thank you for all that information. We've got a lot of statistics, and it's very, very concerning what we've heard. I'd like to know, from your professional opinion and knowledge that you have, has your association, your group, or your professionals approached the government in terms of doing something about the amount of sugar that is in food and chocolates and everything else that children and families are sometimes having a little bit too much of? At the same time, we've got the levels of deprivation that have shown that are important in the children in the area. What kind of reports do you put forward as a combined group to the appropriate departments, identifying that fluoride is one thing on the menu, and I remember well the report that came, Joe, but there are other things that have to be considered in terms of the diet of individuals. I mean, take a can of beans, which is a normal child's beans on toast, etc. The amount of sugar in one of those cans of beans is absolutely incredible. So my question is simple. What, if anything, is being done to address the other side of the coin in the production of food with so much sugar in it? And if it hasn't been approached through government, why hasn't it?
I'll just come in here first and pass over to Rachel, because I think she can answer that question more substantively. But with regards to, there was a sugar tax that had been introduced, and there was a call by the British Dental Association to ensure that all of those funds that were collected in that sugar tax, a large proportion would be put into dental and the promotion of oral health. But it's fallen on deaf ears, and this money seems to have disappeared into the Treasury coffers. But with regards to the other part of your question, I'd pass on to Rachel and Sandra, maybe.
Yeah, hi. With regards to the Department of Health, the British Society of Paediatric Dentistry did welcome a green paper advancing our health prevention in the 2020s, which included a chapter on childhood obesity. We know there are a lot of common risk factors between childhood obesity and dental decay, and the British Society of Paediatric Dentistry are very supportive of the Change for Life Sugar Swaps campaign in England and Wales, Eat Better, Feel Better, which is an initiative in Scotland. There's an Action on Sugar campaign, a Kind to Teeth campaign. There's the NHS Choices Eat Well guide, and as Joe mentioned, there's the government-led initiatives including the soft tissue levy, which was brought in 2018. So there are a lot of national initiatives which British Society of Paediatric Dentistry fully support, including what Joe was mentioning about the dental check by one. So there is work going on. A lot of it is around obesity, childhood obesity, but as I said, there are many common risk factors between obesity and dental decay. I'll see if whether Sandra's got anything to add on that.
Well, before we do, I think that, if I may say so, yes, that's a typical answer that can be put to a lot of things in terms of obesity and causes of ill health, poor health, dental health. And I agree with what you're saying, that it is something that has to be concentrated on. But I'm the councillor for a city ward in Wakefield. Olivia is in one ward of it. Kevin is to the other side. And I'm sure this appertains to across the district. Where, oh where, is there the publication of these communications to people out there? I am involved heavily in the community centre. I know Olivia is, I know Kevin is, I know lots of our councillors here today are. In terms of COVID, obviously there's been a different situation. But up to then, I, from my centre, and I'll ask the others, have never ever been approached to see what publications, what publicity can be put up at the centre which would be really valued and accepted to bring home to people out there who actually bring their children to nurseries as well. What is the good advice needed? It's very good at pointing to all these strategies that are being dealt with internally, but we've got to get the message out to parents, etc., of what is wrong and what's right in terms of children, what to eat and whatever. And bearing in mind, we've 31 food banks across our district. God help us to be saying that in this day and age. But most of those food banks, the people that get the boxes are actually happy to get the boxes. And I know about the issue of the getting out there and reducing sugar, whatever, but I've never ever seen any publicity from yourselves out in the communities which would be of value to the people out there. So why isn't it out there?
I think this is where we need the oral health promotion teams, and they certainly, when the community dental service had an oral health promotion team before it got disbanded, they were going to children's centres, and there was supervised brushing schemes going on in nurseries. And
do you excuse me interjecting? I'm conscious of the time, and you've had a real good time in terms of the report because they're excellent. I don't want to know what were. If we're in the situation that we are here with these statistics, publicity that we all know is something that will hit home to some people. So I don't want to know the words. I appreciate what you've been through. What is going to happen from your good selves in terms of looking towards the future?
We need funding for oral health promotion to be able to send teams back out into the community.
I'm sorry, can I just interject again?
Mm-hmm.
You don't need to send a team out to community centres to give them some posters to put up on the walls.
Okay.
You don't need a team. You don't need a team to leave a box of leaflets and advice about children and brushing their teeth and all the rest of it. That's a revenue cost, as opposed to just having some simple advice leaflets that people can pick up. So, again, forgive me. We always look at a big picture to bring big money. But there's a simpler way in terms of getting publicity out there. And I have not seen anything. And I'll say this, I've been involved in that community centre going up to 20 years. I do remember the team coming out at one time. Nothing's happened since then. So could I just get this straight? There is no way with any of the information that you're getting out there that is valuable information in terms of what's happening to our 0 to 5s, etc., that you can use any of that in a simple little leaflet that only needs to be printed to go out to hang up in our community centres. You might find that some post offices might be able to help you out. It just seems to me that the big picture is something that everybody is thinking about and blaming money, but there's a small picture that can do a lot.
Chair, could I come in? It's Melanie Robinson from Public
Hello,
Health.
Melanie. Yes, dear.
I think I hear what you're saying. I totally agree with that, and I think Joe's popped in the box that we will take this away, take what you're saying away, and we will work with Joe and Nicola from as Public Health, and we'll put some leaflets and information together and get that distributed as quickly as possible. I'm sure that's something we'll be able to look into from Public Health.
I think members will value that tremendously, Joe and Melanie. And the other angle, of course, is you can always give some to schools to give out to the children going home. It's not a great deal of work, but it's a very simple way of promoting the value of good oral health. You know, that's an easy bit. I'm sorry, but it's an easy bit, and it can be done. And if at all, as local councillors in our area, we can help and say where it would be good to put these leaflets or posters, then please do get in touch with us. And thank you, Melanie, and thank you, Joe, for that offer. I do appreciate it. Now, I'm going to move on a bit because I'm conscious of time and with the white paper yet to go. And, you know, I do value the contribution that you've all given today. I really do. We have a report here from Health Watch. I'm sure you've seen the report. As elected members, I think we can all relate to the comments in that report. We hadn't seen it before it come to us, to be fair. We can all relate to the comments in that report. And I think, you know, reading it again, it would actually frighten me to think that we have a society out there, and we know we have because we get these complaints from families, from people who can't get a dentist. I'm going to go back to something that was said earlier on about people moving into the district. I have been dealing with a case for 3 months of a family that moved into this district from another area with a member of their family, a child, who needed a dentist.
George could come and, or could you let George know that I'm here?
You can go straight onto what?
I can hear you. Can you switch off, please? Thank you. And I've been dealing 3 months with that as a councillor on behalf of this family. And the reports that have come back, and I remember Joe saying about it here, the money should follow the patient. That's the ethos of the NHS, and we're part of the NHS and the dentist centre. And that family have been to-ing and fro-ing, and were actually told at one point, it's nothing to do with us up here, we can't get you a dentist, you've got to go back to where you came from. Go back to where you came from, the person did. And was still left in a quandary, no, it's not up to us to do that, you have to go back. Meanwhile, 12 months on, there's no action in terms of the child. I started this in January, and I willingly will, if anybody wants to see the letter, I will willingly blank out the names. And 3 months on, I have had a reply back, apologising that it wasn't taken up, and a letter didn't come back. And then I got the same answers as the lady had been given. Now, I understand, and do forgive me, because I know a lot of members might have these questions as well. I understand when somebody presents for urgent dental care, that according to the information that we have, that person, that child, should not be turned away, and they have a right to seek professional help. So when that parent took that child to try and get a dentist for professional help, what happened? What's gone wrong? I appreciate all you've told us about it, and I know all the members do here today. But the view that we have from Health Watch today is an excellent report, and I will pass on the comments. It's an excellent report. It's down factual in terms of the people they've spoken to. What is being done in terms of the rights of the individual, as I understand it, when they contact a dentist for urgent dental care, that they're not seen to be getting that urgent dental care, and as the report says. So what's going wrong? Why are people having to and fro up and down the country to try and get something done for the members of their family? And forgive me if I get passionate about this, and I know Melanie is here, but we all know what's happening in terms of the situation of dentists. Basically, there aren't enough. And I agree there in terms of the funding and the capacity. And the report speaks for itself. It would be good that we have a follow-up in terms of that report, because there's a lot of issues in it. And I know the members here today would welcome further report in terms of that, because I'm going to be, and I'll say it now, I'm going to be at the end of this meeting. I'm very grateful to all you've done today. I really am, and I know the members are. But at the end of this meeting, if you've seen that report, and I'm sure you have, that report is asking scrutiny today to support it. And believe me, we will be supporting that report going forward today to see what we can do collectively. And I'd love you to be on board with it, because I'm sure we can work together. I think we've got to just start between us now, and where we can work together on behalf of the residents of our district, that's got to be the way forward. And where we feel that our residents, our families, our children are not in the best position to get oral health, we've got to shout out about it as well. So that's the position I'm in at the moment in terms of this. Martin, you have a question? Can you hear me, Martin?
Yeah, yes, thanks, Chair. It'll be one of many other families that are in the same situation, Chair. But just a question regarding, we've talked about Newstead House emergency treatment on a Saturday and Sunday, but do you still not have to be an NHS patient registered to qualify for that emergency service? Otherwise you don't get it, and that doesn't do anybody any help if they haven't got a NHS register.